Honourable Minister Dr. Shane Reti is with us this morning. Welcome to the program. Talofa lava and kia ora. Good morning, sir. How are you?
Talofa lava. I am good, thank you. Nice to catch up with you.
And thank you for your time to spend with us here on Radio Samoa. Recovering well from your trip to the Pacific last
Yes,
week?
indeed. And we got back in late on the weekend. Myself and the Deputy Prime Minister, the Right Honourable Winston Peters, returned on the weekend, and we've hit the tarmac running, and got a lot of work to do this week, but lots of pleasant and warm Pacific memories from our last week through the Pacific.
The last part of your trip was in Samoa. Did you enjoy your time in paradise?
Oh, thoroughly enjoyed it there.
Yeah.
We had meetings with Prime Minister Fiame, and it was lovely to see her again. We then had a major announcement at the National University of Samoa, a 3.4 million, I believe, $3.4 million contribution to the Bachelor of Health Sciences, a new program at the university. And we met some of the students and some of the teachers. Very exciting to think that, to turn on your own domestic pipeline for nurses and for students who might do postgraduate as well. That was very exciting to be a part of that.
Yeah. Okay. And also you announced 15.2 million for the Pacific. What's your expectation? What do you want the Pacific to achieve spending that 15.2 million?
So that was across a range of things, and some of it tied into the meeting we had with the regional directorate for the environment in Samoa spread. And fascinating the sort of work they're doing, just by one way of example, particularly around things like rat elimination. We were fascinated by the 3 types of rat that they find on some of the local islands, and their mechanisms to make them effectively predator-free. So a wide-ranging contribution, but that is one example that was explained to us in detail as to how this funding helps build resilience and environmental protections through the Pacific.
Okay, so let's come back to New Zealand, Minister. There is the referendum that is pushed by David Seymour of the ACT Party. Do you support the referendum for the Treaty of Waitangi? Or?
So you've heard the Prime Minister say that our support was only to first reading, and that is unchanged. He has always said that, and that is unchanged, and that is our formal position.
Yeah. So what's to you as a Minister for Pacific People and also Minister for Health of New Zealand, do you support, I mean, you did mention the Prime Minister's opinion.
My position is the Prime Minister's position, that we will only support it, and I will only support it through the first reading.
Yeah. And as a Maori, sorry, Minister, to ask you, but as a Maori, do you support the government to put more and make sure that they put the fair decisions for the Maori community in Aotearoa?
What I support is outcomes. So we can talk about a range of governance issues, but at the end of the day, particularly in health, what I support are those policies and those actions that help this person get their hip, that help that person with cataracts who's going blind have their cataracts done. That's what I focus on the outcomes.
Yeah. Okay, Minister, please tell us, what is the importance of for us Samoans, the Pacific Islands, and the Maori as well, to know the importance of the Treaty of Waitangi?
So what that describes is a pathway as to how we might interact with each other going forward. This is how the courts have interpreted it as well. And so it's clearly a work in progress, as you've heard the Prime Minister say, and there were a range of views expressed at Waitangi and indeed before Waitangi. It's a work in progress. And there are those, particularly some of the academics who have great skill in this area, who will keep pushing and probing it. Again, I focus on the outcomes. Of course, I understand the importance of that discussion, but I want to focus on the outcomes in the portfolios that I have and how we can make meaningful change to people's lives.
Okay. Honourable Minister, how is the government doing with the first 100 days of what you promised before the election? How are you doing with the first
we're making good progress, really good progress. In fact, one of our experienced longer-term ministers has expressed that this is the most ambitious 100-day project she's ever seen. So we're very encouraged. We had really good work before Christmas. and we've hit the ground running in this new year, and I'm encouraged by how we're progressing.
Okay. The other thing I was supposed to ask you, the budget coming up very soon. What are we expecting? Something that will be good for our Samoan and Pacific Island community in New Zealand.
So I'm not in a position to preempt budget decisions
Yeah.
and budget announcements. But what I can say is I would come back and say that we'll make efficient and effective use of taxpayer money and point them specifically at outcomes. We'll have expectations for the programs that we do fund, that they have a direction, that they have an implementation plan, and that we actually get on and implement it. That's what we can expect in the budget.
Yeah, as a Minister of Pacific People, I mean, what do you want to see in the budget that will, that will benefit our Samoan people and Pacific communities in New Zealand?
So I won't give specifics, but what I will say is that where we would generally be looking for budget items would be those items that affect the economy, how we can reduce the cost of living, would be items around infrastructure, particularly housing, and then items that further support health, education, and law and order. And what we've heard is certainly for health and education that there'll be new money. Others, there may be some belt tightening and improvement in efficiencies. But one would expect a budget to cover across economy. And again, the Minister has talked about tax cuts, the economy, infrastructure, housing, health, education, law and order should be the large areas where budget will be focusing, but I won't preempt the details.
Right. Okay. Honourable Minister, as a Minister for Health of New Zealand, it was reported by Radio New Zealand, I think it was yesterday, that the PET CT scan good for South Auckland. What's your take on this?
So PET scanners are in short supply in New Zealand. They're a high-end, generally cancer management tool. And it's been something that we looked at, particularly for the South Island, before the campaign, and it remains on the table. That's one of the areas that has a particular lack of PET scanners. And so that remains on the table and in our thinking as to how we can distribute this expensive piece of technology so that those who need it the most can get access to it.
Okay. Last time we talked before Christmas, I was asking you about the shortage of doctors and nurses and all that. How is that coming up?
So we've had a significant increase in nurses, particularly internationally qualified nurses, in this last quarter. And I was speaking with the Nursing Council about that yesterday, and it's almost overwhelmed their resources. That's how many people we've had coming in from overseas. Now, there's still a lot of work to be done in all of those areas, with nurses, with doctors, with pharmacists, with allied health. There are still workforce shortages, but our biggest workforce shortage was in nursing. And, I'm encouraged that we may have passed that peak, and that urgent need may be reduced. Now, of course, other needs then come up. Issues of pay parity, for example, with primary care nurses then become a focus, and we're still short of RMOs. But the biggest gap we had, numbers-wise, was in nursing, and I'm encouraged that that looks like it's starting to come down.
Right, okay. Waiting time for people for their operations, hospitals around New Zealand, is it improving or...?
Actually, waiting times are becoming increasingly problematic. We're putting more people onto the list than we're taking off, and that's an all-of-system feature that starts at primary care, right through to acute admissions, right through to bed block, which squeezes people out of their planned surgery, right through to early discharge into the community, which again returns back to primary care. So across that whole spectrum, waiting lists are challenged. We have plans for that, and you'll see that announced when we announce our targets, which will focus our minds and our direction around waiting lists.
Okay, well, we're only into the second month of the year. What's your long-term plan for, as a Minister for Pacific People, what do you want to achieve for our Pacific Island communities in the next 10 months?
What I want to achieve is I want to achieve tangible improvements across all of the key areas that Pacifica people tell us matter to them. Some of them are in my hands, some of them are in all of government issue. There are issues around cost of living. There are issues around housing. There are issues around health, diabetes, for example. And there are issues around education, having our children educated. Some of these levers are levers I can pull inside the portfolio. Others I'm relying on my very experienced and capable colleagues to help with policy decisions. So what I'd like the Pacific Peoples portfolio to do is to focus in those areas where Pacific Peoples have told us they're most concerned, and to have some tangible improvements.
Honourable Minister Dr. Shane Reti, thank you so much for your time. Would you like to go back to Samoa maybe sometime this year?
Oh, I would love to go back to Samoa, and I'd like to take my sweetheart with me so that she can share the bounty and the experiences that I share very much.
Once again, thank you so much, Fafte. Tele love for your time, and have a great day, sir.
Love and to you too, sir.
Fafte, thank you. Le fionga le Minister o se forma lo ina fa pena for Minister Tengah Pasifika, New Zealand, Honourable Minister Dr. Shane Reti, Maltana Wang, and therefore it's